My name's Claire Studer. I'm a registered dental hygienist, and I'm going to be talking about how to take care of your child's teeth or recommend to your older children how to take care of their teeth, and then even tips you can use yourself on how to take care of your own teeth. What causes cavities? When filling out the survey, majority of you answered that sugar causes cavities. This isn't completely wrong, but specific bacteria in our plaque is what causes cavities. Some of you might wonder what plaque is. Plaque is the soft buildup on our teeth that forms throughout the day between brushing. So if at the end of the day, after brushing in the morning, if you look at your teeth, you'll see maybe a little bit of film. It might feel a little rough. That is plaque. This specific bacteria in our plaque that causes cavities can be transferred to your child or even your spouse. So it's very important we be cautious when it comes to sharing water, food, gum, toothbrushes with our kids, because we don't want to be contributing that to their cavities. Basically, the connection between sugar and bacteria causing cavities is bacteria that cause cavities like to eat sugar. So if you're eating sugary food, they're going wild. They'll eat that sugar and then they produce acid that then sits on your teeth and causes a cavity because it's eating away at the hard surface. Can we prevent cavities? Yes, we can. 80% of you actually answered we can, so that's great. So for the few of you that didn't answer yes, yes, we can prevent cavities. We can prevent them by brushing daily, flossing daily, using a toothpaste or mouth rinse that has fluoride in it, um, watching how many times a day we take in anything that has sugar. That could be drinks and food, snacks, and then having a regular dental visit. Can we brushing and flossing? When reviewing your survey answers, majority of you answered that your children are only brushing one time a day. This is actually a common answer I get from not only kids but adults too, at work. I hear this all the time. But the best thing for our teeth is brushing 2 times a day. Essentially, if you want to think about the sugar feeding the bacteria side of it, the less amount of time that sugar is on your teeth or the bacteria are stuck onto our teeth, the less amount of time there is to cause a cavity. So really brushing every morning after breakfast and every night right after dinner, dessert, drinking soda, anything with sugar in it, brush your teeth. You don't want to go to bed with any type of sugar on your teeth from a drink or food or anything. You want to go to bed with a clean slate, basically. And then flossing at least one time a day. What I like to tell people flossing, because many people don't floss regularly, they floss from time to time. I like to tell them you can floss at any point of the day. It doesn't have to be when you brush. As long as you're doing it once at some point of the day. I know mornings are hard because we're rushing a lot of times, and then evenings can be hard because we're tired. So, like I like to floss in the middle of the day when I'm driving. Like at a stop sign, I'll do it, or stoplight. I'll have the little floss picks and I'll floss. So, just an idea. Maybe during your downtime during the day, or your kids' downtime during the day, have them floss during that time. Um, and then, like I said, doing this regularly, brushing and flossing regularly, helps remove food and plaque from our teeth to prevent cavities.
Proper toothbrushing involves 5 things: a soft toothbrush, toothpaste with fluoride, brushing long enough, the correct brushing action, and brushing at least twice a day. You can use a manual or electric toothbrush. Just make sure it has soft bristles. Soft bristles are kinder to your teeth and gums, and they make it much easier to remove the plaque below the gum line, where gum disease starts. Use a pea-sized amount of toothpaste that contains fluoride. Fluoride strengthens the outer enamel layer of the teeth. It can stop a cavity in its tracks and give you more resistance to future cavities. Make sure your brushing routine lasts long enough to thoroughly remove plaque. We recommend that you brush for at least 2 minutes. To start, center your brush on the gum line and angle the bristles at a 45-degree angle. Apply gentle pressure so the bristles slide under the gum line. Gently vibrate the brush while you move it in short, circular, wiggling motions. Brush 1 or 2 teeth at a time, then move to the neighboring teeth, allowing some overlap. Use this method to brush the insides and outsides of all the teeth. To brush the backs of the front teeth, tilt the brush and make several up and down strokes. Then brush the chewing surfaces of the teeth with a gentle back and forth scrubbing motion. End by brushing your tongue and the roof of your mouth. This removes germs and keeps your breath fresh. You can use a tongue brush with a special head to do the job, or a tongue scraper to remove the odor-causing bacteria. When you brush is important too. Brushing after breakfast cleans away the morning's food debris, and brushing your teeth before bedtime protects your teeth all night. Follow our advice for better brushing, and you'll enjoy a cleaner, fresher, healthier mouth.
Dentech presents Triple Clean Floss Picks with Fluoride. Gently slide the mint wax floss up and down between all teeth, removing plaque buildup. Allow the floss to wrap around teeth and clean above and below the gum line. Place the textured pick between teeth and gently press against the gum. Use an in and out motion to remove food, plaque, and stimulate gums. Dentech Triple Clean Floss Picks. Flossing made easy for deep cleaning.
Fluoride. Using fluoride in our toothpaste or mouth rinse, or even the fluoride treatments we get from the dentist. They're great for preventing cavities because it helps strengthen our teeth both topically, and when I say topically, we mean just washing over your teeth, just on the surface of your teeth being there, and then spitting it out. The leftover that's there, it gets into your tooth structure and helps strengthens your teeth. And then systemically, works in 2 ways, from when your child's still forming in you to about the age of 6. Them eating any type of fluoride, not a lot, but fluoridated water will help build the teeth to be strong when they're forming in your children's mouth. And then the other way systemically is if there's fluoride in your diet, from like fluoridated water, um, or even I know some offices they give supplements for fluoride for children. So, anyways, the fluoride will actually come out in your children's saliva, and so it's a topical form of fluoride also. And then the other way it helps prevent cavities is it actually can help stop the production of acid by the bacteria that cause the cavities. sugar intake. Sugar intake, this is a big one, especially because our kids, they like juice, they like candy, they like chips, they like a lot of different snacks, and a lot of times they want to snack throughout all the day. So really cutting down on how many times a day they're eating anything, a carb, any type of carb, anything really. And then drinking sugary drinks, cutting that down will help prevent cavities in the long run. If you are giving them juice, maybe give juice once a day instead of not all day. Or if they will only drink juice, try to water down the juice. But really try to get it to where they're drinking water more often than any sugary drink. And then not snacking a lot throughout the day. That's a really big contributor to kids having cavities. Dental appointments. Majority of you answered in the survey that you do take your children for regular dental visits, which that is great. That's fantastic. Um, Taking them to their regular dental visits helps get them fluoride treatments regularly, which helps prevent cavities. Um, Dentists, they can check for cavities and catch them early so they don't end up being a big cavity where they end up needing a tooth pulled or need a crown, and it stops the spread of cavities in the kid's mouth. Um, and then also children, when their adult molars, their adult molars come in, their big teeth in the back, they can get sealants on them, which help also, or a big help in preventing cavities. And basically what a sealant is, just your back teeth, your molars, they have a lot of grooves in them, and some of them can be pretty deep. So the sealant fills in those deeper grooves so that stuff doesn't get in there, because sometimes if they're deeper grooves, your toothbrush just can't get to it, and so there's just no avoiding getting a cavity in that spot. So sealants are great if your kids have some of their adult molars in already. Sealants would really help with them not getting cavities in those teeth. And then also just having your children, when those of you that have infants right now, about by the first birthday or when their first tooth come in, have them go in for a checkup. Make sure they're on track. They most likely, depending on the dentist's discretion, but most likely won't do any x-rays on your baby, or won't even really clean the teeth. It's kind of just getting them in the chair, looking around, making sure they're on track, looking for any abnormalities. It's really just a checkup, nothing more than that. And I just want to end this by telling everyone thank you so much for taking this survey and watching this video. I hope it gave you a lot of information and maybe taught you some things you didn't know. And I hope that you're able to pass this down to your kids and really affect the rest of their lives, because I mean, having good oral hygiene and taking care of your teeth regularly, it really starts now when they're kids, for them to have a good hygiene and good teeth for the rest of their lives. And if you have any questions that I didn't answer with this video, feel free to message me on Facebook, and I'll answer you the best I can, or put you in the right direction to someone that can answer you. Thank you so much for your time, and I'm just going to click over to the references that I used for this PowerPoint. and that I got my information from.